Everyone, please welcome the 2022 American Academy of Nursing Living Legends, Jane Barnsteiner, William Holzemer, Jeanette Ives Erickson, Norma Martinez Rogers, Joyce Newman Geiger, Franklin Shaffer, and your hosts tonight, President of the American Academy of Nursing, Ken White, and President-elect Linda Scott.
Good evening again. There's a love fest going on up here, if you hadn't noticed. I'm delighted to be joined now by Dr. Linda Scott, the Academy's President-elect. To help me showcase the impressive milestones made by each of our living legends. This year's Living Legends are an inspiration to many of us for their vision and valor. They have served the public with strength and conviction. From military experience to global advocacy, they have envisioned change and made it happen. You will be in awe to hear how Drs. Jane Barnsteiner, William L. Holzemer, Jeanette Ives Erickson, Norma Martinez Rogers, Joyce Newman Geiger, and Franklin A. Shaffer have broken barriers, led with authenticity, and embodied the phrase, "Be bold." That's right. The title of Living Legend of the American Academy of Nursing is not simply a designation for a remarkable individual, but a lasting recognition that solidifies these incredible leaders as change makers. Living Legends have advanced health equity in challenging times, innovated when a solution was needed, and just as critically, mentored other nurses to use their voice to transform the way care is delivered and received. Their contributions lay the critical groundwork for future studies, new technology, and creativity in the profession. Thank you again to our generous sponsor, Cedars-Sinai, for helping to make this evening a memorable event for us all.
The American Academy of Nursing created the Living Legends in 1994 in order to recognize fellows who had made unique, outstanding, and long-lasting contributions to both the nursing profession and to society. Since then, we have honored 130 distinguished individuals. Let's take a moment to recognize these living legends over the years.
I would also like to pause and recognize the living legends who died this year. Jean E. Johnson, Virginia Saba, and Shirley Smoyak, who was both a charter member of the Academy and a living legend. We honor all of the Academy living legends who have died. These leaders live on through those they mentored and the lives they touched. They have impacted lasting change, and we are grateful for their vision to advance the nursing profession. It is now time to recognize this evening's trailblazers for our profession. Dr. Scott.
It is my pleasure to introduce tonight's first 2022 Living Legend, Jane Barnsteiner. Dr. Barnsteiner is internationally recognized as a leader in quality, safety, and evidence-based practice. Throughout her career, she has been steadfast in her dedication to the important integration of service and academia. It has been her mission to ensure that nurses are lifelong learners whose knowledge is evidence-based and it is used to improve the quality and safety of patient care for improved health outcomes. Dr. Barnsteiner is known as an early thought leader in developing and implementing innovative programs to improve quality and safety. Currently, she is a professor emerita at the University of Pennsylvania School of Nursing and is the editor of Translational Research and Quality Improvement for the American Journal of Nursing. She previously served as Director of Nursing for Translational Research at the Hospital of the University of Pennsylvania and as Director of Nursing Practice and Research at the Children's Hospital of Philadelphia. Dr. Barnsteiner began her practice as a pediatric nurse and launched many innovations to help children with complex health issues, such as creating the first pediatric critical care advanced practice program in the world and developing the first course on caring for medically fragile children in the community. She has been an advocate for technology and innovation, particularly when supporting student learning. She also co-authored Person and Family-Centered Care, which received an AGN Book of the Year award. One of Dr. Barnsteiner's most notable accomplishments has been the cornerstone of nursing curricula across the country and in many corners of the world is the Quality and Safety in Nursing Education, or QSIN. Dr. Barnsteiner co-led curriculum development and taught at 11 national QSIN institutes, educating 1,500 faculty about the QSIN competencies. Dr. Barnsteiner is sought after nationally and internationally for her consultation on evidence-based practice, quality patient care, and curricular reform. She co-edited all 3 editions of the Quality and Safety in Nursing, with the first 2 editions receiving AGN's Book of the Year awards. These texts have been translated into 4 languages. Dr. Barnsteiner's outstanding contributions have been honored through Sigma's Dorothy Garrigus Adams Award for Excellence in Fostering Professional Standards, the Lindback Award for Distinguished Teaching from the University of Pennsylvania, and the Robert Wares Patient Safety Award from Jacksonville University. Dr. Barnsteiner's work has transformed how the profession views quality and our engagement in system reform. Let's hear more of her incredible efforts from one of Jane's sponsors.
So I met Jane Barnsteiner in 2004 when the American Journal of Nursing did a project on medication safety with the University of Pennsylvania and some other groups. And Jane was already well known at that point for her work in quality and safety. Jane mentors naturally. She's just someone that exudes a sense of trust that you feel you can ask her any questions, that she has so much to share in so many different areas. She's helped me as the editor-in-chief. She really helped me grow in terms of understanding what research is needed, how research can be better than what we perhaps see in the paper, how it can be formed better, how it can be explained better. She's really a mentor personally, really, as well as a great friend. For me, what makes her extraordinary is her commitment to finding a better way, no matter what she's doing or what practice setting or what educational setting, for anything she's involved in. That's inspiring to me. She's always looking for a better way to improve care. And for her inclusiveness, her generosity, her warmth, and her respect for others, it just sets a tone that makes her a joy to work with. Jane Barnsteiner is the real deal as a role model for nursing. Her whole career has been focused on how do we do better for patients. She's been an extraordinary leader in just about every facet and setting of nursing. She's straddled both the practice and academic worlds, enabling her to ensure that practice is evidence-based and that education is relevant to practice. She's been an early thought leader in developing and implementing innovative programs to improve quality and safety, whether by spearheading parental stay in pediatrics, co-founding a movement to infuse quality and safety education in nursing, transforming educational curricula to prepare nurses and others for contemporary safe practice, or facilitating the dissemination of scholarly work that speaks to these issues and nursing's contributions. It's all about improving how nurses provide care. She's the type of person that is a natural leader, mentor, innovator. I mean, I can't think of anybody else who deserves this.
Please join me in welcoming Dr. Jane Barnsteiner to the podium.
Thank you. Well, I decided to be a nurse when I was about 5 years old, and I was hospitalized for a few weeks for scarlet fever. And the student nurses who cared for me were really amazing in their caring and competence. And then my resolve to pursue nursing really was solidified in my early teens when I decided nursing would be a way out of poverty. My decision has absolutely not disappointed, and I can honestly say I have loved being a nurse. Some of you in this room have heard me tell the story of how I made a mistake when I was a student nurse. And I really thought I would be dismissed from the program, but they didn't dismiss me. They fired my instructor. Hence, quality and safety has been a thread throughout my career. Another passion has been person and family-centered care. I've been fortunate to work with two outstanding CNOs throughout my career, Erna Goulding at the Children's Hospital of Philadelphia and Victoria Rich at HUC, who both valued excellence and innovation. And they allowed me to design and implement changes that really became standards in person and family-centered care. Claire Fagan's doctoral dissertation on the negative effects on hospitalized children who did not have a parent present was the impetus for me to implement 24-hour parent presence for hospitalized children at CHOP. A movement that has spread across all ages. And I will say I'm particularly proud of all the pediatric nurses who fought for parent presence with hospitalized children during the COVID epidemic. Now, for a very long time, I thought I was pulling myself up by the bootstraps, but I realized that nobody ever does it alone. There were many people putting out a hand. And I first of all want to thank the moms in the Tasker Homes Project in Philly, where we lived, who often paid me $0.25 when I was 7 or 8 years old to take care of a bunch of kids on the front stoop. And I think it was my first lesson in leadership. I also want to thank my sister-in-law, who, when I graduated from my diploma program in 1966, said you have to get right on for a BSN, because that's the future. And I also want to thank Ann O'Sullivan, who, when we were finishing our BSNs at Penn, said we needed to get a master's degree, because if you want to be a leader, you have to have a master's. And I thought I wanted to be a leader, so I better get a master's degree. And I'm forever grateful to Clifford Jordan, who told me I needed to go away for a PhD, as I already had 2 degrees from Penn, and I needed to be exposed to new ways of thinking. And that's how I ended up making one of the best decisions in my career, and that was going to Michigan, where I had a dream of a doctoral student experience. We called it Brigadoon. It's also special because it's where I met my partner of 41 years and my wife, Joanne Dish. I thank my sponsors, who really did a magnificent job of summarizing my accomplishments. Sean Kennedy, with whom I've just had a pleasure to work with at AJN, and we now have QI and research in every issue. Tony Villarreal, a fellow pediatric nurse, and the fantastic dean at Penn. And Linda Cronenwet, a fellow Michigan doctoral student, friend, and colleague. I'm proud of the work we accomplished on the QSIM project, and I believe it's one of the most significant movements we've seen in nursing. So my take home, bet on yourself. Don't hesitate to seek advice and use your mistakes for good. Thank you.
Our next living legend this evening is Dr. William Holzemer. Dr. Holzemer is a world-renowned researcher, educator, and advocate for his work to improve the quality of life for people and families living with HIV/AIDS. He has pushed with passion for changes that aim to eliminate health disparities, particularly when individuals are challenged by stigma. Dr. Holzemer is the Distinguished Professor and Dean Emeritus of the School of Nursing at Rutgers, the State University of New Jersey. He is also Professor Emeritus at the University of California, San Francisco School of Nursing, and Distinguished Honorary Professor at St. Luke's University in Tokyo. He currently serves as the Editor-in-Chief of the Japan Journal of Nursing Science. Dr. Holzemer founded the International Nursing Network for HIV/AIDS research in 1996, focused on conducting and disseminating nursing research to help people live well with HIV. Over the next decade, his work spread around the globe and made substantial impact. Botswana, Lesotho, South Africa, and Swaziland are just a few of the countries where he assisted nurses and nurse faculty to understand self and family symptom management for people with HIV/AIDS. His work extended to examining the role of stigma and discrimination on the quality of life for persons living with HIV/AIDS and on the quality of work life for nurses caring for persons with HIV/AIDS. Dr. Holzemer has used his experience and central findings to be a voice for the profession at the national and international levels. Dr. Holzemer served on the Agency for Healthcare Research and Quality's first HIV guideline panel, evaluation and treatment of early HIV infection, and 2 National Academy of Medicine committees. Additionally, he was a member and chair of the CARE sub-panel that evaluated the President's Emergency Plan for AIDS Relief Science, which is managed by the U.S. Department of State. He has provided leadership in academic nursing and HIV/AIDS care to the World Health Organization, the International Council on Nursing, and many universities worldwide. A staunch research proponent, Dr. Holzemer was instrumental in shaping the establishment of the Academy's Council for the Advancement of Nursing Science, in 2000, serving as its first chair. Among his accolades include a member of the National Academy of Medicine, a member of the Japan Academy of Medicine, a former Fulbright Scholar in Egypt, and in 2012, he received the Order of the Rising Sun Gold Rays from the Japanese government for contributions to the development of academic nursing in Japan. Pretty impressive. Let's hear more of his invaluable contributions from one of Bill's sponsors.
I first met Bill, I'd say met in the literature in 1984. I was thinking about getting a doctorate in nursing, and I saw a column that he wrote about computers in nursing in one of the nursing journals. He was at University of California, San Francisco, which was my target school. So I applied, noting that I'd like to be his student. I was accepted to the program. The first time I actually met him face to face was in Las Vegas at a conference. And I was very excited about being his student. I rushed up to him very gushy and said, "Oh, I'm so excited. I'm going to be studying with you." And he was getting ready to do a workshop. And so he gave me a stack of handouts and said, "Sue, the work starts now." I think many people, including people in the nursing profession, might be somewhat risk averse. And it's something that I've always admired about him. And it's one of the things that I definitely learned from him and that I have passed on. He has had influence in multiple ways. First, as a researcher, secondly, as an educator, and thirdly, in policy and organizational leadership. I'd say there's really no one in the world who has done more for really focusing on improving the quality of care and decreasing stigma for persons living with HIV. He played a critical role and was the founding chair of the Council for the Advancement of Nursing Science. When he was Department Chair of Community Health Systems at University of California, San Francisco, he created a partnership that led to development of a clinic at the Glide Church, which is a very special organization in San Francisco that provides social services to the homeless. And that took a lot of savvy to get that done, a lot of political efforts, a lot of academic and other different types of agreements to really make that happen. I would want to thank him for the amazing difference that he's made in my career. Also, what he has done to elevate the voice of nursing and what he has done to advance the quality of care and the quality of life for persons living with AIDS.
Bill, please come to the podium.
As I have shared with a few friends, I'm highly honored and humbled by this, and I particularly like the first word more than the second word, the living part and the legend part. Those who are younger will appreciate that as you get older. I want to thank my nominators, Dr. Suzanne Bakken, Elaine Larson, and Carmen Portillo. I want to recognize my family, Dr. Timothy Bridge, my husband of 40 years. My brother and his wife are here from Arizona, so I want to welcome them. I also want to welcome the dean at Rutgers University, Linda Flynn, who is here, and one of our former deans, Dr. Herdis Griffith. So welcome and thank you for being here. There are many people have affected my life, as I'm sure with yours, but two stand out for me as mentors. The first is the late Dr. Virginia Olson, who was head of public health nursing at the University of Illinois. Virginia brought me into nursing, introduced me to nursing, taught me to grant write, and shared her love of Japan and created for me a 30-plus year romance with the country of Japan. So I really, she was an extremely important person, and those were in the days that you may remember Alma Ata in primary health care. She was a great proponent. The second person is Margreta Stiles. Greta recruited me to California, gave me all kinds of opportunities to serve in leadership roles, and she's passed as well now, and also introduced me to some of the opportunities in international work. So to my colleagues at UCSF and Rutgers, and those of you who've gone on to bigger and greater things, thank you for being part of my life, and I am truly humbled and honored by this. Thank you.
Next, I have the honor to recognize Dr. Jeanette Ives Erickson as a living legend. Dr. Ives Erickson's profound impact has guided practice, research, and education outcomes for decades. The depth and scope of her interventions have been implemented nationally and internationally. Her platform as a chief nurse executive has allowed her to create highly effective models of patient care, nursing practice, interdisciplinary teamwork, diversity and inclusion, and research infrastructures. Currently, Dr. Ives Erickson is the interim CEO and president of Nantucket Cottage Hospital, chief nurse emerita at Massachusetts General Hospital, or MGH, an instructor at Harvard Medical School, and chair of the Board of Trustees and a professor at MGH Institute of Health Professions. She's busy. One of Dr. Ives Erickson's most influential contributions is the design, implementation, and dissemination of the professional practice model. Beginning in 1995, she led the model's creation within MGH, which made advances in practice that improved care and enhanced quality as well as safety. The model provides the framework for achieving clinical outcomes driven by critical thinkers and strong decision makers and continues to flourish today. This model is used by over 100 healthcare institutions in 15 countries. This model was used and allowed MGH to become the first hospital in Massachusetts to receive magnet designation by the American Nursing Credentialing Center. Recently, she co-led the design and opening of the Jihui International Hospital in Shanghai, China, a tertiary care facility that received a Rare Joint Commission International accreditation. As a champion and seasoned philanthropist, Dr. Ives Erickson laid the groundwork to establish the Center for Nursing Research at MGH, raising over $29 million to include support for nurses and the innovation that comes from their critical science. Mentoring and supporting the next generation of nurses has been central to her career. Dr. Ives Erickson initiated the Clinical Leadership Collaborative for Diversity in Nursing at the University of Massachusetts, Boston. Based on this initiative, Dr. Ives Erickson received the inaugural American Organization for Nursing Leadership PRISM Award. Most recently, Dr. Ives Erickson was on the front lines of the pandemic. She was appointed by the Massachusetts governor as co-medical leader and operations chief for the Boston Hope Field Hospital, which served post-acute COVID-19 patients and homeless patients at the height of the pandemic. As effective vaccinations emerged during the pandemic, she was commissioned to serve as incident commander for the Mass General Brigham system-wide effort to vaccinating over 100,000 patients. Let's hear more about her sizable impact from one of Jeanette's sponsors.
I first met Jeanette at Mass General in the late 80s. She had started working there 6 months before me. Jeanette had recently graduated from Boston University School of Nursing with a master's in nursing. This is where she first learned about the importance of creating a professional practice environment where nurses feel supported, have opportunities to become the best clinicians they can be, and most importantly, have a voice in the decisions around practice that most impact patient outcomes. Jeanette is a nurse first, and that drives everything she does. She cares about the patient, the family, clinicians, and support staff. An example of Jeanette's passion for and impact on nursing happened at the Huashan Hospital in Shanghai, China. Mass General Nursing had established a twinning relationship with the nurses there to guide their professional development. Jeanette was addressing an audience of 250 nurses, describing the attributes of a magnet hospital. She asked all the nurses to stand and turn to the colleague on either side of them and thank them for all they did. The response was powerful and unexpected. The auditorium erupted with cries of joy and gratitude. The emotion in the room was palpable. With that one simple exercise, Jeanette enabled those nurses to experience the power of recognition, perhaps for the first time. I will never forget that moment and the masterful way she orchestrated it. The lessons that Jeanette took from Muriel Poland all those years ago continue with her leadership of the ANCC's Commission on Magnet. I'm sure Muriel is smiling down on her as we celebrate her brilliant career and consummate leadership. Her willingness and ability to solve the most vexing problems has helped make the world a better place. Jeanette is at her absolute best when she is being of service to others, which is why she has dedicated her life and career to improving the care of patients and families all around the world. If that's not the stuff of legends, I don't know what is.
Jeanette, please join us at the podium.
So like my colleagues here, I'm really honored and absolutely humbled by this recognition from the American Academy of Nursing and from all of you colleagues that I admire and I respect. I am grateful to those that nominated me, and I'm going to tell you about the lessons that I have taken from this nomination. First, Paula Malone Nuzzo, who lit the fire. and she talked to me about, yes, you are a living legend. Let's talk about the number of young people that you have helped enter into the profession. An educator all the time. Then you just met my wonderful friend and colleague, Marianne Didamasi. Together for 21 years, we resisted being second place. We inherited a physician-driven organization that is now a magnet for nurses. So thank you, Marianne. A lifelong colleague, Kathy Bauer, who just helps everyone wherever she can. But in this process, she's the person who brought the red pen. And to Susan Grant. Susan and I have had a wonderful journey together. And with Susan, as very young nurse administrators, together we realized that speaking up and speaking out when it wasn't always popular, but when it was the right thing to do, we did that together in the city of Boston. I also want to recognize Dottie Jones and Gordia Bannister, who helped to contribute to the stories that led to this nomination. So thank you both from the bottom of my heart. I also want to acknowledge our president, Ken White, for his contributions to nursing and to our academy. He's had a global impact on thousands of nurses, but he's making a wonderful impact in the city of Boston, and we're grateful to have him with us. I also want to congratulate fellow inductees Jane, Frank, Bill, Norma, and Joyce. Listening to these stories has just been inspirational, so thank you. Yesterday, my colleague Joanne Dish said, "Are you ready for your speech to tell your story?" And I said, "Not really, not really." But today I went for a 6-mile walk. Yes, I did skip the meetings. I did what I always do when I come to Washington, D.C., which is to go to the Vietnam Memorial to pay tribute to those veterans. And of course, yes. And of course, as I was saying my silent prayer at the Nurses Memorial, 2 reflections came to me. Freedom is not free. Freedom is not free. And as nurses, we can bring voice to this pretty troubled world. And we need to learn from those nurses. They were brave. And so freedom is not free. So as nurses, let's bring voice. Let's continue as strong, caring, and compassionate people to make this a little bit more gentle world, a little bit more gentle country. The second reflection I had is passion has led us here. Those are words I heard recently at this month's Magnet Conference. And this was a speaker who was talking about the need for everyone to develop a bucket list before you die. And he said, when you check off things on that bucket list, remember passion has led you here. And so, nurse colleagues, passion has led us here. Not here tonight, but here in everything that we do as nurses. And so I thought about passion has led me here, and I thought about my bucket list. My bucket list included going to Mercy Hospital School of Nursing, and then becoming a critical care nurse at Mercy Hospital. And it was the wonderful leader of the School of Nursing, who was also the director of the Department of Nursing, who one day said to me, "It's time for you to go. It's time for you to go. You're going to go to Boston University to get a graduate degree." And it was at Boston University that I met the wonderful Muriel Poulin that Marianne talked about. For those of you that are the non-nurses, Muriel Poulin was one of the original researchers of the Magnet Hospital study. She was a force to be reckoned with. A force to be reckoned with. She instilled in us all of the values that nurse leaders need to bring to the table. All of the values that we need to instill into the staff nurses, the clinical nurses that we work with. And one of the things that she taught us, and we called ourselves Muriel's Girls, she taught us that we needed to be a mentor and to get a mentor. And I took that to heart through the rest of my career. To go on to be the chief nurse at the Massachusetts General Hospital was a privilege I have never taken lightly. To work with 5,000 incredible nurses each and every day that cared deeply about the work that they did caring for their patients and the interprofessional nature of the care that was so important. Many of us then took the lessons from the MGH on our international journey, especially in places like Shanghai, China, where we spent a significant amount of time working with nurses who really needed to be lifted up, nurses that did not have a voice in decision-making, and why we really had to bring to them this notion that, yes, we can, in fact, do this. I also had the privilege of becoming a Robert Wood Johnson Executive Nurse Fellow. Now, think about being an RWJ Nurse Fellow. So my program was led by two living legends. Two living legends. Marilyn Chow, bless her, and Sue Hassmiller, another living legend. And oh, by the way, also teaching in that program was tonight's Healthcare Leader Award recipient, Jenny Chin Hansen. How lucky are we to have those three wonderful nurses? My project at the RWJ Fellowship was to study the role of the Chief Nursing Officer in integrated delivery systems. I hope that those lessons that I learned there on my bucket list, I have been able to share with other nurse leaders and emerging nurses from out this country. So you can tell that I have had a wonderful career, and I have benefited from so many of you in this room and the wonderful nurses that I work with at the IHP and throughout Boston. I do recall, though, being here a few years ago when I was inducted into the academy, and how excited my husband Paul and my mother were. They were just championing, and my mother, I remember, crying. So I have to acknowledge that I think the two of them are looking into this room today with a big smile on their face. I'm looking at my baby sister, and she's probably thinking the same thing I am. She's already annoyed with me for saying baby sister. My mother would be saying, just remember where you came from. Just remember where you came from. We're a family of immigrants, and we're lucky to be here in the United States, and we're lucky to have these opportunities. And she would say to me, now, make sure you get back to work, Jeanette. So before I leave this podium, I do want to say thank you to my wonderful sister, Judith. thank you for being here. And to my partner, Alistair Kahn, thank you for everything and for being a wonderful champion. And so, colleagues, thank you for this wonderful recognition. It really means a lot to me and to all of us.
Our next Academy Living Legend to be honored this evening is Dr. Norma Martinez Rogers. Dr. Martinez Rogers is a lifelong champion for underserved populations. She is nationally recognized for her fierce advocacy, community organizing, and policy expertise at the local, state, and federal levels. She is a mentor, educator, and agent of change. Dr. Martinez Rogers is Professor Emerita at the University of Texas Health Science Center, San Antonio School of Nursing. During her time at UT Health San Antonio, she was the first and only full-tenured Latina professor and founded Juntos Podemos, Together We Can, a peer-to-peer mentoring program for nursing students that was funded for over 15 years to increase retention and graduation rates, especially among first-generation graduates. A dedicated mentor and advocate for Latinos in nursing, she also founded the International Association of Latino Nurse Faculty, which hosts the Cultural Inclusion Institute, and currently she serves as president. Early in Dr. Martinez Rogers' career, she was a teacher at Edgewood Independent School District and a caseworker for San Antonio Catholic Family and Children before launching into her nursing career. As a public health nurse in Austin, Texas, she grew to understand the great need to address health inequities. Later, Dr. Martinez Rogers joined the Army Nurse Corps, and during Operation Desert Storm, she was assigned to the William Beaumont Army Medical Center at Fort Bliss in Texas. Here she served as a psychiatric clinical nurse specialist, where she earned achievement and commendation medals. This public service laid a strong foundation for her role in helping to shape health policy. Appointed by the U.S. Government Accountability Office, she was a founding commissioner of the Medicaid and CHIP Payment and Access Commission, which examines how Medicaid payment affects access to care by Medicaid patients and those in the Children's Health Insurance Program. Thank you. Dr. Martinez Rogers' energy is unstoppable. Currently, she oversees a $2.5 million Health Resources and Services Administration grant to recruit and engage baccalaureate nursing students to engage in community-based primary care to help advance public health. Additionally, she's the chair of the board of directors of Ride Connect Texas. You're busy. A nonprofit that provides transportation for the elderly to access health care. Dr. Martinez Rogers also co-founded a nonprofit organization, Martinez Street Women's Center, whose primary purpose is to provide support and educational services to women and female adolescents, serving over 12,000 clients. One of Norma's sponsors has more to say about her success. Let's listen.
I met Dr. Martinez Rogers during her tenure as the president of the National Association of Hispanic Nurses. We had the opportunity to have a conversation about the importance of recruiting nurses into many specialty fields across the profession. But what sparked my interest in her is her energy. She's a dynamo in so many different ways, but I love the fact that she has always had a caring heart and desire to serve nurses as well as her community. Her ability to not only balance the clinical side of nursing but also the humanitarian side of it. She is a nurse scientist, researcher, and public policy maker. And I find that very rarely do you find nurses who are able to do all those things in the course of their career. Her energy and her excitement around the profession is truly one of those things that draws you to her. Dr. Martinez-Rogers is a phenomenal mentor and coach for young nurses, but also nurses who've been in the profession for quite some time. I have personally benefited from her mentorship throughout my career. She's given me the courage and often sometimes the momentum to move forward during challenging times. What I've enjoyed about Norma is that her wisdom comes without judgment. She allows you to explore your career based on your terms and explore your dreams. Norma is the mentor that young nurses can benefit from because of the wealth and the depth and breadth of her experiences. Her ability to not only deliver high quality care as a clinician, but she's also been a soldier, she's been a policymaker, and she brings all those skill sets to the arena. She is a trailblazer. She doesn't mind being the first to do many things as she has in her career, and she's never afraid to take a chance. I think that what she's done in the field of nursing for not only Hispanic nurses, but all nurses, is an example of how to develop leadership skills and be the front runner in the profession. Dr. Norma Martinez-Rogers deserves to be recognized as a living legend of the American Academy of Nursing because she has been a trailblazer her entire life. Coming from humble beginnings, reaching the highest levels of academic success, this woman has put forth so much effort to serve the lives of others and her nation. For that reason, I think she deserves to be recognized as a living legend.
Dr. Martinez-Rogers, the podium is yours.
Well, if you notice, I did not come with a piece of paper, but it is in my heart and in my voice. I'm extremely grateful and humbled to be here. I'm also when I was a child, my mother said, you have two choices. You can be a nurse or you can be a teacher. I said, well, I don't want to be a teacher. So I went into nursing, and what do? I teach. After I got my master's, my second master's in psychiatric nursing, a woman named Jeanette Wilson, who was, by the way, the first Mexican-American nurse to get her PhD in nursing from the University of Texas at Austin. I went to work and she said, get in the car. This was about a month after I had got my second master's. And she says, get in the car. I said, why? She said, we're going to Austin. I said, for what? She said, you'll see, get in the car. So we drive to Austin. We drive to the University of Texas at Austin. We go into the School of Nursing. She had made an appointment with the dean, and she introduces me to the dean, and she says, this person will be coming to your school. She will be getting her PhD. And that is what I did. It took me a while because I had to go to Desert Storm and I came back, but I did come back. I have been very, very fortunate, I have been very fortunate in my life. I didn't do this journey alone. No one does it. No one in this room accomplished what we did alone. Every one of us has brought people, has had people help us become who we are. I am who I am because of my parents, my family who's here. My spouse of I think 32 years. But I've also been very fortunate that I've had colleagues, wonderful colleagues like Dr. Antonia Viruel, who has tried to be my mentor, has a little hard time, but has given me good advice and has certainly told me, oh, I don't think so, Norma. But I was also very privileged to work at the University of Texas Health Science Center at San Antonio, where Dr. Patty Hawken brought me on board at that school. But I was very privileged that one of my sponsors, Dr. Eileen Breslin, who was my previous dean, encouraged me to do whatever it is that I needed to do the kind of things that I wanted to do, because my mission in life will always be to help the underserved population, because that is what all of us in here should do. That is what our role is as nurses, to help the underserved population, to help the at-risk population. And I'm going to say this because I am a Latina, that there's 3.8 million nurses in the United States. Of that, there's only 350,000 of us that are Latinas. So every single one of us have a responsibility to bring in more minorities, because that is the majority population. The other is, I want to quickly thank Dr. Connie Huerta, who's been one of my colleagues and has helped me along also, has given me good advice, and I appreciate that. And most of all, Dr. Sylvia Trent Adams, who could not be here because her plane was canceled in Dallas. But she has definitely been, if anyone remembers Dr. Sylvia Trent Adams, if you recall, she was the first nurse to ever be the acting Surgeon General in the United States. So she is here in spirit. But I leave you with these words. All of us in this room have made it. Every single one of us. Every single one of us has the responsibility to grab hold of someone else's hand and bring them with us. Because next year, we will have new people. As we get older, we're legends, but we're still living, you're right. But we still have that major responsibility. Don't forget that younger generation of nurses who have gone through so much through this pandemic that really need our help to stay in nursing and to guide them, because they will one day be a fellow in the American Academy of Nursing. Thank you, Academy.
Next to be recognized as a living legend of the American Academy of Nursing is Dr. Joyce Newman Geiger. Dr. Newman Geiger is a pioneer in transcultural nursing. As a prolific writer, her work has transformed how nursing education is taught and how federal policy is made. She is a formidable champion for health equity, and her legacy transcends generations. Currently, Dr. Newman Geiger is professor at Florida International University College of Nursing. Formerly, she served as president of the American University of Health Sciences, as well as professor and Lulu Wolf Endowed Chair at the University of California, Los Angeles. Of note, she was the first African-American nurse to be appointed as a tenured professor in the history of UCLA's School of Nursing. Additionally, Dr. Newman Geiger was the dean of the School of Nursing at Columbus State University and founding dean at Bethel College. With over 190 articles, 14 book chapters, and 8 books, Dr. Newman Geiger has developed a model for assessing phenomena relevant to delivering culturally appropriate care. Her best-selling textbook, Transcultural Nursing, Assessment and Intervention, has been widely adopted by 357 schools of nursing in the United States and abroad, and has been, yes, and also has been translated into 7 languages. The Office of Minority Health within the U.S. Department of Health and Human Services features her model as one of the overarching models for rendering culturally competent care. The Emergency Nurses Association adopted her model to guide the development of their position statement on diversity in emergency care. The American Association of Colleges of Nursing used it as a theoretical framework to develop undergraduate and graduate toolkits. Dr. Newman Geiger has a long history of involvement in groundbreaking research in transcultural nursing and genetics, transforming care. Her research focuses on genetic indices and other physiological predictors of coronary heart disease among premenopausal African American women as they relate to designing culturally competent interventions to stop the phenotypical expression of risk indices for the development of coronary heart disease among this vulnerable population. Dr. Newman Geiger has served as editor of the Journal of the National Black Nurses Association for over 20 years. And further service to MBNA in 2020, Dr. Newman Geiger led a team of MBNA nurses to develop an award-winning article on the effects of COVID-19 in African Americans and co-wrote a proposal to receive a much-needed grant to address vaccine hesitancy in pregnant Black women. It is an honor to recognize a trailblazer who has shaped how we provide care with cultural humility. Let's hear from one of Joyce's sponsors.
I've known Joyce for, over 20 years, but I actually knew about Joyce when I was working on my doctoral program. When I was president of the National Black Nurses Association, that's when I became intimately involved with Dr. Geiger. She was our journal editor. She always pushed the envelope, looking for the best standards, making sure we were at the top of the line, that we were able to publish articles for minority nurses who were unable to get their articles published in some of the other journals. So she was that sounding board. In addition, she would provide educational sessions, writing sessions, to teach nurses how to be prepared to write articles and prepare for research. She actually came up with an idea. There was no nursing models to talk about how to provide culturally competent care to patients. So that idea then moved ahead and became the whole foundation of her work and the cornerstone in transcultural nursing to ensure that culturally effective nursing care is provided to all patients. Right now, everybody's talking about DEI, the elimination of racism, etc. But Dr. Geiger was doing this way before, I'm gonna just say it, that things got popular. She's always pushing the needle. She's always available to assist whoever needs her aid, her assistance, whether it's all of the publications that she's written, textbooks, etc. But she's definitely been a key figure and is a key figure in this whole movement with transcultural nursing care. Her inspiration has been, she's just been very willing to be involved with individuals, but Joyce is fun. I mean, what can you say about Dr. Geiger? But she does stick to business when it's time, but there's no other Joyce Newman Geiger than the one we're honoring this evening.
Joyce, please join us at the podium.
I'm honored to be here this evening, and I just want to spend a few minutes talking about I'm done crying now. I'm going to let the rest of you all cry and try to invent something to make sure we render culturally competent care every day. I would like to thank the members of the Academy of Nursing and Dr. Deborah Toney, Dr. Linda Burns-Bowden, and Dr. Betty Smith, who served as my sponsors for this wonderful honor. I'd like to also thank them because they never tell me no. If you know me, I call you every Sunday right when you're about to go to church. But because I need something for the young people out there that are endeavoring to be a nurse. As I said, I'm done crying, so let me just go back what I'm talking about. As a Black nurse, having done this for 50 years, I got to this stage as an African American. It's very, very important to talk about the historical account of how one stands here on the shoulders of so many. I want to reach out and say thank you to Dr. C. Alicia Georges and Dr. Beverly Malone and Dr. Barbara Nichols. I've called them too, and I think they just didn't answer the phone, but whatever. I never got tired of calling people, Black, white, Latino. We're going to talk about some Black folks who need you. I want to thank my husband, Augusta, and there's a funny story about that man. My children, D'Artagnan, Carolyn, Tay, and the young man who walked me to the stage, who actually works in adult protective services and with children. And he didn't know me, but I called him up and told him what he could do for adult children in a whole new state. And he said, "Who are you?" "You'll know by the time I'm done." And his name is Dr. Michael Blanchard. And so he's become one of my children. I hope he's happy. I was born in Memphis, Tennessee, and I was raised in the Mississippi Delta. That was a struggle. But I was raised during Jim Crow, a bigger struggle, because many of the things that all of you are used to, you didn't find that in the Mississippi Delta. You didn't find hospitals and care for African Americans. If you know history, Hill Burton came along, but it didn't do much for African Americans who lived in the South, particularly Mississippi. When I was 13, we moved to South Bend, Indiana, and there I met my lifelong sister friend. Her name is Catherine Grundy Davis. She has spent 50 years telling me how to do nursing. Thank you, Catherine. She's not a nurse, by the way. My mother told me that we would always be lifelong friends, and we are, and she's sitting next to me tonight, telling me what to do with the next phase of nursing. Thank you again. We both have risen to any challenge to be with the others over these 50 years, and in the honest is her daughter, Diana Lynn Peterson. She is not a nurse, but she tells me things about nursing, and she ordered everything in my life here today. In the audience also are young people that I know, and I tell you, I celebrate with them and I try to help them understand that giving care to people who come from a depressed environment and all of that is really important. And if Hill Burton didn't come around for years, there was no chance for hospitalization and care like that. You probably wonder how I got here and why I'm standing on this stage. By the time I was 15, I met a group of women who would endeavor to help me grow. These women were from the South Bend alumni chapter of Delta Sigma Theta. They decided I would go to college. That was interesting because I was not interested in college. They also decided I would become a nurse, another no, and that I would pledge Delta. I didn't know what that was until I met them. So at any rate, they said, you'll go to college, you'll do all this. And there was one glitch in their decision making. I had not applied to go to college. I had got a job when I was 16 at the Urban League, and I was really good at what I did. For you young people, I ran the mimeograph machine. And I wasn't just good at it, I was excellent at that machine. So I told them, why would I give up something this wonderful? I'm just trying to figure this out. They got so mad at me, they called a very great person. That man's name was Whitney Young. And if you know that name, that was way up there. And they said, tell her she should go to college, because they'd all gone to college with him. He called me up and he said, Joyce, you're going to college. You're going to be a nurse, pledge Delta. And I'm like, but I'm good at the mimeograph machine. You want me to give it up? He said, yes, I want you to go to college and do something beyond that mimeograph machine. So off he sends everything to the South, to a school. And I hear from these people, and they said, we've admitted you based on all you've done, blah, blah. And I'm thinking, now I've got to work. I was really good, and now you're going to make me work. So, okay. I went off to college because these people were great, and they were really interested in me. My college years were like my earlier years. It was covered with people who decided what my life should be and how I should do it. And some of you are still in this audience, okay? So when I went to school, I want to thank Dr. Ray Charles Harris. She's not a singer. She's a woman that meddled in my life affairs. And I love that woman. And the late Joanne McAdory for helping me to understand nursing and how important it was to do something for minority care. I graduated in 1970, happy to be where I was, but not satisfied. I met a wonderful man. I married him, and I thought he would always take care of me. Well, I can tell you one day I needed that man. I called him and said, they tell me I can't graduate with my doctorate. And he said, why not, Joyce? He said, because, I said, it's because of Brown v. the Board of Education. That school doesn't think that I need to meddle around and go to college and get a doctorate. And he said, well, I'm not going to do anything about it. And you know what? I'm not going to call you a doctor when you get it. So you better figure out something you should do right now. So I went to the graduate school, and I told him what my husband said, and I said, he's crazy. I'm going to get a doctorate, and I'm going to graduate in a few weeks. So I'd get to writing those papers. So I got a doctorate. Came back home, and I was working in a hospital, and a young white woman came up to me, and this is a true story. I said something worse than I'm going to tell you. She said, Joyce, can you tell me what to do with a dark-skinned black person when they don't seem to be, they seem to be having trouble breathing? I looked at her and I thought, uh-huh. I said, is her chest going up and down? I think so. Did you lick the back of your hand? Could you feel any air coming out? I don't know, I didn't try that. And I said, is that woman alive? That was very important. And there comes transcultural nurse. And she said, I don't know. And I said to one nurse, you walk down there quietly and see if that woman's alive. If she's not, just come out of the room and quietly say, code her. She came out of the room and she said, code her. And I thought, oh my goodness, this woman's gonna die, or she's dead. Turns out she did die, and I went in the restroom and I cried all day. And I decided Something has to be done. Do I write a book called I'm Done Crying or what? I then met one of the greatest people I have ever met. Her name is Dr. Ruth Elaine David Nether. She died 11 years ago. She and I wrote everything, and half of you thought she was my sister, but she was white, and I know you knew that from looking at her. So no matter what I said to Ruth, we were going to write transcultural nursing. I want you to know she introduced me to great people. I haven't seen you, Angela McBride, but for 30 years she wrote the foreword to that book. And then I said, I'm going to quit writing that book. Aren't you all familiar with this? And you know what to do? Well, I want you to know that I'm not going to quit writing this book. I ain't no ways tired. I might be old, but tired I am not. By the time I arrived back in the South, I met some other people who probably were just as annoyed with me as they could be. I met Dr. Ora Strickland and Dr. Michael Weaver. They're sitting over there, and they know that every time I called them, they wanted to say no. But they didn't know how to say no to somebody saying, but Michael, this won't take long. But Ora, you need to do this. This is all I know. You just need to. And they would say yes if I would go away. But then I remind them, I'm back here to help black folks. When I was in Acapulco with Dr. Strickland, a group of women, there they go meddling again, representing the National Black Nurses Association, invited me to be the editor of their journal. And I have been their editor since 1999. I keep trying to figure out my way out of that. But they call me on Sunday mornings and ask me to help them write. One of those people is sitting in this audience, and her name is Dr. Tammy Thomas. She's one of the greatest grant writers, but she said, don't you remember me? I don't remember 10,000 people, but I'm trying. At any rate, I want you to know one last thing I leave you with, why we need transcultural nursing. You can call it by any name you want to, but Hill Burton didn't change all that much. And there are many other things. I had a medical occurrence. You can probably tell that from looking at me. I called my good friend, Dr. Dorothy Wiley. She's in the audience. And I told her what the medical emergency was. And she said, well, meet me at the hospital. I live in the Mojave Desert, Lowell. So I went to that little southern hospital in the West. And the man said, what do you think you got? I tell him what I had. He goes outside and he talks to Dr. Wiley. He said, that woman's an alcoholic. And I thought, she said to him, and I appreciate what she said, do you know she doesn't drink at all? And so he came back in. He said, what do you want to do? I want her to go get me a pint of ice cream, and I want you to start admitting me to this hospital, and I want you to give me the right kind of meds that you need to give me, because I'm going to get mad and call somebody you don't want to see up in here. So then I did all that, and the next day, Dr. Wiley went and told another good friend of mine, Dr. Mary Ann Lewis, that I was over in that hospital eating ice cream, and I'm a diabetic, so I didn't have no business doing that. And so all I know is the man came back in and he said, you know, Dr. Geiger, there's an ambulance out there. It's from UCLA. They want you to come right now, not later on. Stop eating this ice cream and get on over there. So I went over there and I met the chief of a certain, but now you know what I had. So the guy said, those are terrible people. They thought you were drunk and they weren't going to go any further than she's drunk, okay? And they wanted Dr. Wiley, just take her on out of here. I'm getting ice cream, laying down, watching TV, and I'm not leaving. One of the things I want to do is tell you I ain't done. I'm no ways tired. I'm working with a new group of people. I'm working with Dr. Nola Holness, Dr. Beverly Frey, and Dr. Bridget Johnson. And truly, we are doing, I think, groundbreaking research on COVID among African Americans, because the African Americans were not even being treated fairly when they went to the hospital. They would sit there 15, 16, and 20 hours with, you're just drunk, and if you go home and leave that liquor alone, then you won't have COVID. Wrong. You will have COVID still. And so we're doing that. I'm also working with Margaret Brown and Dr. Berthel Archie. I'm reminded, young folks, some of you my age, that every step you take is ordered. I wasn't supposed to be doing mimeographing. I was supposed to be in somebody's face saying, that person is not drunk. You need to really do something to take care of them. So every step you take is ordered, and how you got from there to here is ordered by the people you meet in your life. Be nice to them, because they got something to teach you. That's all I got to say. And how you got from here to there is that you remind those people every day that you love the things that they do for you. And I don't think Angela McBride is in this room, but I want to say, lady, I love you a lot. Because she never, ever said, it's Sunday, don't call her. And I thank you all. I really appreciate this award, and I'm not done, Doctor. I'm going to keep on working.
Our final living legend to honor this evening is Dr. Franklin Shaffer. For over 60 years, Dr. Shaffer has been a formidable voice for the value of nursing in transforming healthcare delivery. His name is synonymous with international nursing impact, and he has dedicated his life's work to supporting communities around the globe. Currently, Dr. Shaffer is President and Chief Executive Officer of CGFNS International Incorporated, formerly known as the Commission on Graduates of Foreign Nursing Schools. CGFNS is the world's leading standard-setting and credentials evaluation organization for nursing and allied health professions. Dr. Shaffer has advanced the organization beyond the United States into 6 countries and expanded the professions encompassed from 6 to 15. There is no area where Dr. Shaffer has not left his powerful mark. He has led a progressive nursing career, interconnecting clinical practice, administration, education, research, and consultation, focusing on regulation, credentialing, quality, and global collaboration. He has challenged every norm in the nursing profession. Dr. Shaffer's path-paving doctoral research on diagnosis-related groups led to seminal work that acknowledged the fiduciary aspects of nursing in healthcare economics and finance. Today, health systems and universities worldwide recognize Dr. Shaffer's premise that nursing is not just an organizational cost, but a source of revenue and value. As evidence of Dr. Shaffer's impact, the United Nations recently recognized nursing as an asset as opposed to a cost and established the High-Level Commission on Health Employment and Economic Growth. Dr. Shaffer drives effective global and national policy on migration, human resources for health, and ethical recruitment via advocacy, research, and consultation in particular via CGFNS's Alliance for Ethical International Recruitment Practices and the International Center on Nurse Migration. Dr. Shaffer is an NGO representative to the United Nations, the World Health Organization, and the International Council of Nursing. He was recently appointed to serve on the board of the Conference of NGOs in consultative relationship with the United Nations, the leading voice for civil society within the UN system. Dr. Shaffer is a prolific writer and co-authored 8 books and over 200 publications. His research has focused on international topics such as global nurse migration trends, sustainable development, global health, and ethical recruitment. He is a visiting scholar at Tor Vergata University in Rome, Italy, and the University of Our Lady of Good Counsel in Tirana, Albania, and an adjunct faculty at the University of Minnesota School of Nursing, the Louise M. Fitzpatrick College of Nursing at Villanova University, and the Johns Hopkins University School of Nursing. It's time to hear from one of Franklin's sponsors on his incredible impact.
Frank Shaffer is an entrepreneur and a visionary who recognizes and uses opportunities to leverage positive impact for the nursing profession. And his impact has been felt in practice, education, policy, and international nurse migration. His work on establishing the worth of nursing first caught my attention. Then I realized what a strategic thinker he was, how he thought out of the box, and how strategic he was in using his various platforms to actually bring about important changes in nursing. What I very much admire about him and why I think he's a role model is he's never reluctant to lead, even when many others cannot see where he's going. And I think that's a great characteristic of a leader, to lead when other people don't know where the end is, to step out in front. He's often ahead of his time in recognizing and acting on evidence. Frank is extraordinary as a human being and a leader because he is what I might call a quiet disruptor. He's not flashy, but he's so strategic and has such a forward-looking vision of what's happening in the future and how to leverage it for change, that I think it's that kind of quiet, disruptive capacity that he has that really helps him change things. If I were able to hand this award to Frank personally, I would say thank you from the entire nursing profession for your lifetime of contributions to things that have been really important. Thank you for being willing to take on unpopular issues and show how we could make them matter in advancing nursing. Thank you for helping to raise the resources that have supported the advocacy for nursing research. Thank you for fundamentally making the nursing profession stronger and able to have a more important and significant effect on the patients that we serve. Thank you, Frank, for all of your 50 years of contributions to advancing nursing. You deserve to be a living legend. You are a living legend.
Frank, the podium is yours.
Thank you. I don't think that was me. I don't know where Linda found all that, but I certainly liked it. I am very fortunate to be a nurse, and I'm very fortunate to be here with you tonight. I come from very humble, poor beginnings, but I'd like to first thank the president of the Academy, Ken, and the Academy's board of directors. In addition, I'd like to thank the selection committee of the Living Legends. I have so many of you in the audience and beyond that I could thank for making me who I am today. I really appreciate it. But there's so many of you that it would be impossible for me to begin. I know I would forget a few, but I would really like to take a moment to reflect and thank my nominators. They have been friends of mine for almost my entire career. I consider myself a very fortunate human being. Dr. Linda Aiken, Dr. Pamela Cipriano, and Dr. Beverly Malone. I have the best. And somehow they created a miracle by taking my career span and making it very eloquently come together and present to the Academy Selection Committee. I was so honored when I received this selection notice. I couldn't believe it at first, but I'll tell you, I am so happy for it. I would like to just reflect on a few people that couldn't be with us tonight that have made a tremendous impact on me. First and foremost is my mom. My mom would love to be here tonight. She was my best friend, my constant supporter, but she passed away 9 years ago. She was here in 2000 when I was inducted into the Academy, and she was beaming, and she was so proud. She might have not known what it all meant, but she could feel that it was something worthwhile. I would also like to take a moment to reflect on somebody who has really influenced me from the bottom of my feet to the top of my head and to my heart, most importantly, and that's Dr. Robert Piemonte. Dr. Piemonte was my professor, my mentor, my friend, my colleague. He influenced me more than any other person in my life, other than, of course, the person I'm going to mention last. But Bob was a real friend. He guided me in so many wonderful ways. I had the unique opportunity to write about my mentoring experience with Bob in Man's Up, the book. Bob got the book and he called me. He was so proud and pleased that I wrote that book. But I will tell you something. I graduated from a 3-year diploma school. I completed a bachelor's in nursing education. I wanted to go to Columbia University Teachers College. They wouldn't admit me at first. Why? I didn't have a BSN. So I had to go to school to make up some credits. Now, I lived in Elizabeth, New Jersey at the time. But I went to school. I didn't want to go and repeat all the things that I've done. So I went to Medgar Evers College in Brooklyn, New York. It was a college designed for the African American client. I came from rural Pennsylvania. The closest house to us was 5 miles away, and it was all dirt road. No water in the house, no bathroom in the house. Those were my beginnings. But I didn't know that we were poor. I felt we were very rich. My father had passed away when I was in 6. My mother was left with 4 children. She also wanted to be a nurse. But she had to stop working, or start working after she completed 8th grade in education because she was the first daughter in the family, and she had to help raise her fellow brothers and her sisters. So Bob Piemonte saw something in me. I said, I'm going to go up to Columbia University, and I'm going to take non-metric courses because I have a degree already. So what did I do? I didn't know really Bob at the time. So I signed up for his classes. Why did I sign up for his classes? He was a nurse educator, a man, and a nursing service administrator, Jeanette, and a professional leader in professional organizations. That man encompassed everything of what I was feeling at the time. I needed somebody like him in my life, somebody who could serve as a role model for me. So remember, I worked in Elizabeth, New Jersey, went over to Medgar Evers College to get some more credits, then went up to Columbia University 3 days a week to get the other credits. Bob Piemonte's class with me started at 7:30 at night, and we finished at 9. And for some reason, some way, he got in the very last portion of his lecture, he started talking about something that really got me going. And I would ask a question. Bob said to me, Shaffer, you would. And he meant, it's time to get out of here, and you're going to ask that question. But I was like a sponge in Bob's class. He never could teach me enough. He could never go on and on. He gave me so many things and so many pearls that I treasured for the rest of my life. Bob passed away a little over a year ago due to COVID. But he helped so many nurses along this journey of ours. He made it a better world for us. He paved the way. I'd like to go into a couple other people, if you don't mind, that influenced me that couldn't be here tonight. Leah Curtin. Leah Curtin, for all of you, for some of you who don't know her, she was a former editor-in-chief of Nursing Management. She taught so many of us how to write for publication. She also was a solution for many nurse executives. Her editorials cut to the chase. They said it like it is. And it helped many nurse executives solve their daily challenges every day. Leah did it because Leah knew policy and politics and nursing's role in this healthcare system of ours. Leah is a wonderful friend. She still lives in Cincinnati. Her health wouldn't permit her to be here tonight. There's one other person I feel I need to really mention, and that's Sister Rosemary Donnelly. You can clap for her. She's a wonderful person. Sister Rosemary, during her tenure as the Dean of Catholic University of America, set the educational standards for the United States, many of the standards, and around the world. And she continues to do so in her position as faculty at Duquesne University. I learned so much from her when I was on the staff of the NLN. She was the president of the National League for Nursing, but she was also the president another time of Sigma Theta Tau. And later she became my boss and the chair of CGFNS International. I learned about leadership of professional organizations, but what I really took away from Sister Rosemary was governance, the function of it, and the importance of mission and values. Her conversations and her discussions resonated with me for a long time, will always resonate with me. She's a mentor and a friend, and I think the world of her. She's also a confidant that I can go to her many times about issues or problems that I might have along the way. But I know that she was going to tell me straightforward what I probably needed to do and not want to hear. But anyhow, I could go on with so many people. There's one other person that I was so hoping that could be with us tonight. But she called me, she said, Frank, I can't be with you tonight. It's my sister. I have COVID. So she couldn't be here, but that would have been my only relative next to my husband that would have been with me tonight. But I know she's here in spirit. Let me tell you, and I know it's late, and I know you're tired, and now you want to get to the receptions, so I'll try to make it quick. But let me tell you how I became a nurse. My father died when I was 6. My mother was left with 4 children. We lived in rural Pennsylvania, very poor. I mean, I would go to school with patches on my pants, and other kids would laugh at me. But I didn't know different. My other brothers wore them too. So anyhow, that was some of my beginnings. But while I was entering my senior year, I fell, and I had a big wound in my leg. And my mother came home from work from the factory, took me to a town near us called Old Forge. It was late in the day, or late in the evening, and most of the physicians had left for the day. Their offices were closed. But one light was on the second floor, and it was a doctor's light. So my mother said, let's go up here. So we went up, and it was a Dr. Alexander Zinovinko. Dr. Zinovinko sutured me up, and on my follow-up visits, we became friends. So on one of my last visits, he said to me, "What are you going to do, Frank, now that you're going to be graduating in less than a year?" I said, "I want to be a doctor." I said, "I want to be a doctor very much, but my family don't have the money, and we don't have, and there were no things like scholarships back in 1959. So he said, "Why don't you do what many physicians do in Russia?" He said, "They're first nurses, and then they go to medical school." I had never heard of a man in nursing, never. And I thought that was kind of odd. So on my way home, I thought about this. How could I ever be a man in nursing? I had never heard of it. So I thought, well, I couldn't tell my own family about it. My brothers would laugh me right out of the room. But anyhow, I got enough courage to find someone who might help me. And that was our school nurse. She was phenomenal. Her name was Jeanette McLean. And she listened to me, and without any kind of judging, she said, "Frank, we're going to write to the National League for Nursing, and we're going to get a list of the schools that admit men." We did, and there were 3 schools at the time that were admitting men. There was one in Philadelphia, psychiatric hospital in Philadelphia. Another one, Bellevue Medical in Mill School of Nursing in New York. Erickson Brothers in Chicago. But she pointed out to me, "Do you see this one school here? They're going co-ed for the first time." So we sent in my application for all of them. I was accepted by all of them. I visited all of them. But this one school that was going co-ed for the first time, when I visited there, I felt I really belonged there. I felt I was home and I needed to go there. And that's where I went, to Mercer Hospital School of Nursing in Trenton, New Jersey. That's how I feel about them, too. But anyhow, I was the first, there were 2 of us to be admitted in that school, 2 men. When I appeared on the first day of school, the other guy never showed up. So I had to ask myself, do I have the courage to be the only one, the first one to go through 3 years of this? Do I go home and do it differently? I said, no, I'm going to do it. Well, I did it, and it was probably one of the best decisions of my life. I worked with them where they designed my program, and they asked me a lot of information and advice how I felt about the program, even right down to the uniform. What should a man wear, or the chevrons on the sleeves? But I will tell you what, I took all the ridicule. I took the comments, and at that time in 1959, there were quite a few. The one that will always resonate with me, which I got so damn tired of hearing, is, "Where's your cap? You're a nurse." And that helped me be stronger at what I was doing. I will tell you, though, I graduated from Mercer Hospital School of Nursing, and I remember that was the year that the American Nurses Association published its position paper on you had to have a baccalaureate degree to be a registered nurse. I had just graduated 1 month prior to that with my diploma. So I did a little bit, I said to myself, I'm going to get involved with this profession at that level. I was interviewed by a newspaper in Trenton, New Jersey when I graduated. I outlined that I was going to go to the National League for Nursing Bev. I was going to be a consultant at the National League for Nursing. I was going to help change nursing education. I was going to work with the profession. And you know, I read that as I prepared for some of these talks today, and I went right down that hit with what my life was going to be, a lot of it, in 1965. I had no idea what I was talking about. But I'm so glad I got to live it. Anyhow, I could want to tell you many wonderful stories, but I thank so many of you in this room for helping me on this journey. It has been a journey for me that was packed with joy, love, and passion, as one of my colleagues said. This has been a wonderful career for me. Think of it. A boy from very humble, poor beginnings, standing before you tonight as a living legend, recognizing some of the contributions or the difference that I've made in nursing. You don't know how honored and humbled I am, what a difference you're making in my life. I'm just turned 80, And I'm still working till the end of this year. But I'd like to mention just two other people. But as some of my colleagues have said, we don't do this alone. This journey is never alone. So when someone says to you, your career is what you make it, I disagree. It's what others help us make it. And so many of you have helped me along the way. But there's two special groups that have really helped me. It's the migrants and the refugees around the world. I learned so much from them. They've made me a better global citizen. But they also, a lesson I learned from them early on, America's not the best at everything. If you just stop a little bit and take a look at what we have, you too might see how good it is. I learned that early on in working with the Philippine nurses and other nurses. I have to thank Barbara Nichols for cautioning me about some of the steps I was going to take. My predecessor at CGFNS. Barbara taught me so much before I became the CEO, president, and afterwards. And she continues to do this. When she got inducted into the American Nurses Hall of Fame this year, she came over and we were celebrating her. And then at lunch the next day she goes, and don't you retire. Don't retire, don't have any parties until it's the 50th anniversary of CGFNS. Well, Barbara, I'm sorry, I am going to retire at the end of this year. I'm not retiring from nursing, but I'm retiring from CGFNS at this point in time. There's a time in your life that 40 years of travel becomes a little too much. But there's also a time in your life you have to slow up, smell the roses. I haven't done that enough in my life. But I've been a workaholic. Anyhow, I could go on and mention a lot of people, but one of them is Michael Bly, who taught me much about sticking to the agenda and important items, get that done first. The next person is someone who's not a nurse, but what he did for nursing and what he did for me is phenomenal. And he's in the room tonight. When he found out I was becoming a living legend, he said, we're going to have a big reception. I said, no, let's go to others and enjoy them. Because we're only going to be competing with each other. It took a while to convince him that we should do that. He and my other good friend, Melissa Fitzpatrick. I'd like Jonathan Ward to stand up. Jonathan. It's Jonathan Ward. If you ever get the chance to talk to him, ask him what he did with nursing during COVID and how he did it in more than one country. Do get the opportunity to talk to him. He's not a nurse, but what he has taught the business sector about how we as nurses are important and how, if they work with us, we can make them a better place and really generate a lot of money. But anyhow, I have to mention one other person. Not I have to. But I really, 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 really have got to mention this one. This is my husband, my lifetime partner of 55 years, my Joe Hopkins. Joe. He's been there for me. He's kept the home lights and fires burning. He's helped me through the difficult times I had, as well as the good times. He is also a nurse. And I remember when he said to me, I think I'd like to be a nurse, because we got together before he became a nurse. I got out of the Vietnam War, and I was an Army nurse, and this is 1969. I got out of the Army, and I was going to go to school to get my bachelor's degree. Joe got out of the Navy. We didn't know each other, but we met in a small gay bar in Scranton, Pennsylvania. We had to sneak in and we had to sneak out. In those days, queer was not in. like it is today. Matter of fact, they'd like to wait for you outside and beat you up. But Joe and I, we've had a wonderful life. And my mother said to me, when I had to travel and Joe was with my mom, she wasn't feeling well. That night I came home, we had dinner together, and she's thinking, here's something's coming. And she said to me, you know, Franklin, Joe's a better nurse. He is very caring and loving, and his touch conveys that. I said, I agree with you, Mom. That's why I'm living with him. But anyhow, I thank all of you, each and every one of you, for helping me enjoy this journey. It's been a journey packed full of passion, love, and helping to make a difference in people's lives who really need it. You've made a difference in mine, and I really do appreciate it. Thank you very much.
Please help us celebrate our newest American Academy of Nursing Living Legends.
As you can see, their work demonstrates the passion, commitment, and ingenuity of the nursing profession. Their contributions and the dedication they have to the health of the public remind us all of the power that is in each one of us to strive for a better tomorrow.
It has been an honor for Linda and me to be with you this evening. These titans within our profession demonstrate the intelligence and humility that has opened doors and pierced glass ceilings. We are grateful for their boldness and bravery. Thank you for joining us tonight to celebrate our 2022 American Academy of Nursing's Living Legends. Enjoy your evening.